كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome again to our series of healthy lifestyles. And in today's series, we want to talk about hygiene and sanitation. And as we have been discussing, our main objective of this series of healthy lifestyles is to give people feasible, practicable, simple things, activities or actions that they can do by themselves or as a community or with a family. And today we are actually going to discuss about a subject that is very important to all of us, and it's something that actually affects us every day in our daily life, in and out. So hygiene and sanitation is very important in terms of the individual perspective, in terms of the community's perspective, and in terms of the whole society's perspective. And briefly, we like to talk about what is hygiene. Basically, hygiene is the cleanness of a person in terms of prevention of diseases. So it is more just than cleaning oneself. There is that aspect that you are doing this thing because you want to prevent yourself from getting diseases. You want to maintain the health that you have. And these involve several issues that we actually do day to day. And sanitation basically is a bigger cleanliness in terms of the compound that you have, the public activity, the public health actions that we are doing so that we can actually have an environment that is healthy. And this is very important. We know in terms of the issues that affect or are caused by lack of hygiene and sanitation. We know, for example, there are many diseases actually that are caused by lack of maintaining personal hygiene, by lack of maintaining the environmental hygiene and the environmental sanitation. And the lack of this practice of hygiene and sanitation, actually, it is important in some few areas, and especially the health aspect. We know that there are many diseases that actually prevented by maintaining proper hygiene, personal hygiene, and environmental sanitation. We know that we can prevent so many diseases by practicing appropriate hygiene and having a healthy environment. We know that in proxy, poverty actually can be a result of poor hygiene and poor sanitation. And this is so because a person who does not maintain a proper hygiene and environmental sanitation will be affected, will have several diseases, and once one is sick, will not be able to be productive, will not be able to go his day-to-day economic activity. And we also know that some of these diseases actually cause death. So in the long run, they actually will lead to lack of development and cause this effect. We also know that lack of proper hygiene and sanitation actually is one of the main cause of death of children under 5 years. And we know diseases like diarrheal diseases, including cholera, is one of the major killers of children who are under 5. And this is basically because of poor hygiene. And globally, actually, a quarter of all the children under 5, actually, the death is caused by lack of proper hygiene. So it's a very important thing globally. And more so in our areas, in our countries where we are less developed. We know that our infrastructure, especially for sanitation, for water, for sewage, and for removal of waste is not as good as in other developed countries. So we are actually even more affected, and it will be important for us to know some of the things that we can do actually to maintain our personal hygiene, to know how to maintain our environmental hygiene. So this becomes very important because in the long run, we'll be preventing diseases and we'll be preventing even death from this. And basically, this significance of having proper hygiene and sanitation, one as I mentioned earlier, it is a major cause of waterborne diseases. So there are diseases that actually, because the water is contaminated, it will actually lead to diseases like cholera. It can lead to diseases like typhoid, diseases like polio also are caused by organisms that actually have been transmitted through the fecal matter. So if people are not practicing proper disposal of fecal matter, then it gets into the water, and once it is in the water or it is in the soil, then it contaminates the water and it gets to the food, or through the water itself, it gets to people, and people have these diseases. We know also that poor hygiene is one of the main cause of heath infection. This is the worms that actually infect people, especially the children. And we know that this is very significant because it leads to a lot of problems in children in terms of they have malnutrition, they don't feed well, they don't grow to the expected weight and height, so they are stunted, that is, they are short for their weight and their height, and it also makes them not be able, for example, to attend school, and it affects their education because they might be having abdominal pains or they might be having diarrhea. So these also affect their learning, and in the long run, a person who is affected in his or her learning will actually not be as productive as a person who was not. So these diseases, which are caused by poor hygiene and sanitation, can actually be prevented by simple practices. And we will like to discuss briefly on some of these practices, but before we do that, we like to see what are some of these personal hygiene areas that are very important. For example, the care of the eye. And we know the eyes can get infected very easily once someone's fingers are contaminated. If you went and touched or you held something that had been contaminated by a person who had a disease, either because of poor fecal disposal, then once you scratch or you scratch your eyes, you can actually get easily infected. The same way, if, for example, you touch your mouth or your nose, the organisms can get into your body and you can have acute respiratory infection. These are diseases of the chest which can actually affect you. We know generally with the body, if you're not practicing proper hygiene, then you'll have problem with the skin. The skin is one of the organs that is most affected by poor hygiene, and you'll have issues to do, for example, like a ringworm on the head. You'll have the ringworms also on the body. So you will have problem because of this sanitation, and even organisms like jiggers that can get into between the toes. So this is because of poor hygiene. So we also know that the mouth oral hygiene is very important, and these we can maintain it by brushing our teeth, and especially for us it is important as we go for every salah we brush. So this is one way that we can actually maintain our hygiene of the oral area. Then we know that there is that personal behavior, personal habits that are very important. If you do not do them properly, you'll actually be not having proper hygiene. And these include things like bathing. These include things like washing your hands at critical times. These include being in areas that are clean. So these are things that you can do and are easy to do to prevent these diseases. In terms of once you know the significance of these practicing of proper hygiene, I think it's important that you have like a schedule and you start the small things that you can practice and you can sustain them so that you can actually be doing them continuously. It's not an on and off thing that you're doing. And this is important that first you start as an individual, and then you can cascade it to the family members, and later to the society around, and basically the community that you are in. And in terms of sanitation, this is basically the management of the waste, the management of water, that is rainwater that is around, and more so the compound that you are in, what are these simple things that you can do? And we know that one of the main source of contamination of our water and food is because the environment that we are in, we are not taking care of it. So it is actually important that we do simple things that will actually help, one, in disposal of waste, two, maintaining our water sources that they are safe so that they are not contaminated, and three, that the environment we are in, we are taking care of it so that it serves us for a long time and it does not get contaminated. And these are important because they'll, in the long run, stop us from getting these diseases. And for the community, it will be important that they all do practice environmental sanitation, because if one or the other people are practicing but the others are not, it's also possible that the infection, the contamination can arise from the people who are not practicing. So it actually is a communal thing to prevent these diseases, to have this health in terms of the community. Otherwise, the ones who are practicing will be affected by those who are not practicing. And it will be important that they all engage in this personal hygiene and environmental sanitation activities, so that in the long run, they're all moving together in the same direction and they all maintain the health. They all try to prevent diseases, and they all reduce in terms of the infection that they can get from not practicing proper hygiene and sanitation. Welcome back to our second part of this series of hygiene and sanitation. And earlier you had mentioned that there are several areas in the personal hygiene of a person that somebody needs to take care of them, and more so looking at issues to do with bathing, looking at the issues of clothing, looking at the issue of personal oral hygiene, looking at the issue of how to take care of our skin, looking at how we take care of the cleanness of our feet, including the nails, which is very important. And then after this, we look at the broad environment. What are some of these things that we need to do? So it is important that, because of the body, especially in terms of sweating, and especially during days or the weather when it is very hot, when we sweat, we actually removing excreta, we are removing waste from our bodies, and these actually, when they're on our body, can be a good environment for organisms to grow and multiply, and these can increase the rate of somebody getting sick. So it's very important that at least somebody can have a bath once or twice in a day. Then it is important that you have clean clothes, you change your clothes so that actually they do not accumulate dirt, they do not accumulate germs. And if whenever it's possible, it also helps for the clothes to have been ironed, because this actually, if there were any organism on them, they will kill them. In terms of oral hygiene, especially during times that you have taken sugary things, but it is important that in the morning and in the evening, actually, you make sure that you do so, but you increase in terms of whatever meal you have taken, especially the sugary meals, the sweets, that take the cakes, so that actually we can avoid the food accumulating in our teeth, and this becomes a good environment for the germs to actually feed on and later affect the teeth. Then, in terms of the feet, it is important that at least you clip your nails, you cut your nails after some time, so that they are not, they don't grow to the extent that they're beyond the skin. But also, when you're cutting, you don't cut very close to the skin level, so that you do not injure the skin next to that place, or doesn't get injured very easily because you have cut the nail too deep. So it is important, because these are some of the areas that actually can harbor the germs. They can hold the germs because it's in between a space between the nail and the fingers. So these are some of the things that you need to do. Then hand washing is very, very important in terms of preventing diseases, in terms of our personal hygiene. And hand washing, the best is actually to use a soap. If you don't have soap, you can use ash, but at least you should use some detergent of some sort that it can help in the cleanliness. And the hand washing, actually, there is a particular way that you do it, but basically you need to make sure that all the areas of your hands are being washed. That is the palm area, the inside of your hand, the upper part, so that the both upper part, when you are washing, you wash it properly. Then you need to take care of the areas within the nails and the fingers. So cleaning it, rubbing it against the other fingers, that's very important. Then the areas in between the fingers, especially the thumb and the other thumb, so that you clean it in between. And then the areas on the palm, you can actually clean them more, so that you remove all the dirt, the germs that is there. Then use running water. Running water is the best, either from a tap or either from somebody pouring water on your fingers, so that you wipe with the flowing water. And when possible, you wipe with the disposable paper that you can throw. So you need to wash the hands properly, the way it's supposed to be. Otherwise, also you could be washing your hands, but you're not washing properly. You still maintain the germs. And then we should the few critical areas that it is very important for one to wash one's hand. We are looking at one, especially before eating food. It is very important for you to wash your hands, so that if you had any germs, you had any organisms on your hand because of holding, touching other things, you can actually avoid transmitting it through the food. Then you can also, it's important to wash our hands before we prepare food, so that we should not contaminate the food. It is important to wash our hands, especially after using the toilets. These are times that is very important for us to reduce transmission. Then for those who are taking care of children, it is very important that after they have changed their napkins, they have changed their diapers, that they wash their hands, so that they do not transmit or contaminate other things with their hands. Then the personal habits that actually encourage personal hygiene is very important. For example, wearing clothes that are clean, walking in environments that they are clean, avoiding contaminated areas or contaminated food, so that you can actually not transmit this food. So it is very important to know that most of these infections that are transmitted by these fecal matter, actually they have things that facilitate them to move from the fecal matter to the food. And this is the area that we can actually try and target, so that we can have high personal hygiene and sanitation, so that we break the transmission. And these main 4 areas are things that actually will facilitate this transmission. Will be things like house flies. So the flies actually can move, can get to the fecal matter that has not been properly disposed to the food. We are looking at fields, materials that could be outside, or people have used them to dispose. This is fecal matter, and then they can get to the food, for example, in the market areas, and then the food will be eaten. Then we are also looking at fluids which have been contaminated. We know if people are not disposing waste properly, especially fecal matter, it will get into the grounds, it will get into the soil. And once there is rain, it can easily get into the rainwater. And then when people use this, actually they can get infected. And we also know that most of our water pipe system, actually it can easily get contaminated by the running rainwater, because sometimes they pass through the same areas, they pass through the same holes. So it is very possible that they get contaminated. So these rainwater, by us disposing fecal matter properly, will avoid contaminating them. So the fluids will now have less chance of transmitting these organisms, these germs into our food. So it is important that we can target these areas so that we can have proper hygiene. Then the environment itself has to be clean, and we maintain the sanitation. And basically, these we are looking at public health action. For example, having clean days where people can decide on a particular day we can clean our area, we can clean our environment. These also involve policies or regulation that actually can enhance proper sanitation in terms of provision of clean water, in terms of proper disposal of waste material, and in terms of proper disposal of fluids which are contaminated. So these are areas that can enhance the environmental sanitation. Then the issue of provision of potable, safe water is very important, especially at the source. Sometimes the water comes that it is clean, it has been treated, but when people now start using it, they put it in different containers, either for drinking or for moving it from one place to the other. These are some of the areas that we have to be more careful, because these are the times that we can actually transmit organisms, transmit germs into this water. Despite the fact that it came clean, it was safe, now it becomes unsafe because of the containers that we are using and the way we are moving it from one place to the other. So we need to ensure the safety. And if we are going to store our water, we need to store it properly, and sometimes we can use simple mechanism to make our water safe. For example, just putting the container in the sun, the ultraviolet rays will actually destroy the germs if there are any in them. We can also boil if it's possible, or we can use chlorine-based tablets that actually can make our water more safe. So the water storage before it is used is very important, and we need to make sure that this water is clean and safe for use. The environment issue, the people who are taking care of the waste management, if they are available, it would be very good for them to make sure that there is a proper handling of the waste, there is proper disposal of the waste, and there will be enough information so that the people can know how to do it, and especially if they need to put the waste at different disposal materials so that the disposal and it can become more safe and even better. Then we need to look at if people are sick in terms of they did not implement proper hygiene and sanitation. They need to know some of these symptoms, and they need also to know that they can move to the next step, that is seek for medical assistance so that they can actually be treated. And some of these things actually will be obvious. For example, eye infection, people coughing, one having diarrhea, it might be accompanied by fever. So some of these things that when they come as the symptoms, it will be advisable for one to seek medical advice. And then issues like, for example, the children, when they're complaining of abdominal pains, or they are become poor feeders, or they are not gaining weight, these could be a sign that either they have an infection, they have worms which are disturbing them, and they need to get medical assistance. But more importantly, even if they're getting medical attention or medical assistance, is that the maintaining of their health is very important. The prevention practices, activities still need to maintain, because in the long run, even if they get medical assistance, but they come back to the same environment, they'll be infected again. So the personal hygiene, the environmental sanitation still has to continue so that they do not get reinfected. And also diseases, for example, malaria, which are also caused or are increased by how we maintain our environment. It'll be good that we remove the bushes. If there is stagnant water, we need to make sure that it actually flows. And these need to be done continuously so that a person who was once infected, for example, by malaria, once he goes back to the same environment, is not infected again. So the sanitation, the good practice in sanitation, and need to be there to reduce reinfection, and maintaining the sanitation also by preventing those diseases being transmitted. It means that they are actually cutting the circulation of the organism, and in the long run, it is the community benefits from this lack of transmission of these diseases, and these, in the long run, will help the people maintain their health. It will prevent them from getting diseases. It will also help them in the economic activity and basically in the national development. What we are saying briefly in conclusion is that we need actually to be very cautious and keen about our personal sanitation, our personal hygiene, and our environmental sanitation by doing the simple things that we can actually do by ourselves as individuals, by the community, and as families.
كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي